Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truth for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu broadcasting from Rochester Chiropractic, and it's Wednesday night, and that means we have Dr. Jeffrey Haddad, the most wonderful dentist that I know of, on the air. Welcome to the show, Jeff.
What a great introduction.
Yep.
Thank you.
And I just want to say, Jeff, thanks for handling so many of my patients lately. I'm getting just awesome feedback. You've really helped them in so many ways, from pain down the arm, which I would have never referred patients in the past for when patients are having numbness down the arm, thinking that can be TMJ related, and the sleep apnea. Besides doing the getting rid of the amalgam fillings and the TMJ, I always referred patients to dentists. So I really feel blessed that I've met you fairly recently in time, and it's not like we've known each other 27 years.
No.
But I'm getting great results, and I appreciate how you're handling and treating our patients.
Well, I appreciate your trust in me, and I mean your patients have been great, and a lot of patients even from the show, who found me, just people who genuinely want to be helped, and it's very nice when somebody does trust you, because you know as well as I do, you want the best for your patient. And a lot of people are skeptical. They think you're maybe trying to sell them a bill of goods when really you're just trying to do what's best for them. And it's such a nice thing as a doctor to have patients that do value your opinion and do what you recommend for them. We were just talking about a family that we know earlier, a great family, and they trust you, your opinion. They know that you want to help them, and when they listen to you, it all goes to plan, and everybody's happy.
Everybody's happy.
That's the good news. So I appreciate obviously the referrals, and again, vice versa. I have so many patients that just rave about everybody here. And
your patients are like your children sometimes, and who are you going to put them in the hands of? And when you make a referral and a recommendation, you want to make sure it's somebody who really loves them and cares about them, and
it's an
going to give them
of
the best
your own
possible care that you can possibly get.
No question about it.
Yeah.
No, and I'm just glad that you're back after your big vacation.
Yes,
and
that was a vacation.
I
got a lot of vitamin D.
I'll bet.
No seasonally affected disorder on my end.
There's no sad people there. That is great.
Yeah, it's a long plane ride, We did our last two shows this week about taking probiotics.
Yeah.
When you travel, it's so important to take the probiotics, and it's a long plane ride, down under to Australia.
No question about it.
We're on the Great Barrier Reef, which you can see from outer space. It's so, amazing. The amount, how do you, snorkel and see all the colors and the fish and the variety and think that there's not a God, that this wasn't created, that it just happened.
Right.
There's no way. There's just so much intelligence and life force. It's just amazing.
It is on my bucket list. I promise you. I need to get there.
And I'll tell you, we did a few shows a month ago. We did a few shows on salt and all the different types of salts.
Yeah. I'm so glad you brought that up. All right, that's a good coincidence.
Okay.
Tonight, I was actually, my wife and I went to a cooking class. It was actually more of an eating class, I feel like. It was more of a demenstration. It was actually at, I think it's called Simply Good in Birmingham. Yeah. It was excellent. I couldn't recommend it higher. But when they started off, they actually talked about salts. And I'm not sure if you're familiar with it, because I wasn't. It's called Diamond Crystals Kosher Salt. And this evidently is the if you went into all the top kitchens in the world and any commercial chef, they use this Diamond Crystals kosher salt. And she said 99% of these commercial cooks use it, and I didn't understand why. Well, evidently, a lot of people's recipes turn out very, very salty. And, maybe you've followed a recipe to the T, and afterwards you're like, why is it so salty? Well, this special salt these chefs use has only 200, and don't quote me on this, I just heard it tonight, 200 milligrams of sodium, I believe, in a quarter teaspoon. Okay, I believe that was it. Compared to some sea salts or even the table salts that have 500 to 700 milligrams of sodium. So it's like, wow, it's half or a third of what the normal salt is. So you're following your recipe at home with the normal salt, and that's why it's so potent. In addition to the fact that too much sodium, as I'm sure you covered, is not great. So
not good.
I'm so glad you brought that up. It
throws off your electrolytes.
Yeah, it was interesting. You have to look that up. Again, that's about all I know about it. But
is cool.
It was interesting.
I'm gonna do a little. I did a little bit of Googling on that.
Yeah,
and I guess it's how they formulate the crystals to make it less dense. So it's taking up more room on the teaspoon, and
there you go.
It dissolves easier. They bust it up.
Evidently, this is a secret of all good chefs. Yeah. So there you go, listeners. You can start wowing your family, I guess. But it was interesting. It was like I said, it was a great time and good food, and here we are.
Awesome. Yes. Tell you, I got to snorkel in saltwater every day. I got to be in saltwater and
I love the ocean.
Do a lot of exploring of these islands. There's so many islands and so many Aboriginal caves with cave writings and hiking and.
That's amazing.
Yeah.
Oh, that sounds great. I'm glad you had such a great trip.
It's amazing.
Well, tonight.
So. What are we going to talk about?
Well, what we're going to talk about, I think, is, and I'm not sure if everybody out there knows, February is Dental Health Month. And
February.
It's
that's funny that it's Valentine's and it's Dental Health Month.
That's true. And actually,
it's almost like it's Halloween, so let's have.
I agree. They're going to offset all the candy. And actually, I'm glad you brought that up. We are going to cover. I've got a little I don't know, a rating system, if you will, on some candies.
On
candy that Valentine's Day is coming up. I'm sure we're all going to splurge a little bit.
Yeah.
There's some candies that you should stay away from, and some candies that. In moderation would be fine, But, with Dental Health Month, it's interesting because, and the reason I'm kind of thought about this for the show tonight was I gave a little presentation to my 4-year-old daughter's class, her little preschool class at First Friends here in Rochester. And, 15 to 24-year-olds, it's a tough crowd. Okay, I mean you gotta be on your game there. And I lectured to hundreds of dentists, and I'm gonna tell you, I was a little bit nervous for the 4-year-olds, but
more than the dentist.
Oh yeah, I'm telling you, you've got to really know your stuff. But I'll tell you, really, when you simplify things, it dawned on me that I don't know how many adults truly know the simple things to really keeping your smile healthy. And a lot of maybe the newer things that are maybe, I hate to use the word pushed, but highly recommended by dentists to children nowadays, different than when you and I were growing up. I think we've talked about this in the past. I was a bad kid. I had a lot of silver fillings in my mouth, and I was proud of them because the education wasn't there. I really thought it was a good thing to get fillings, And so what we taught these children is, first of all, obviously, we need to brush 2 to 3 times a day, of course, with fluoride toothpaste, which is very important. Flossing at night, again, once a day is great. But the one thing that I don't know if everybody out there realizes is how important fluoride does play a part in our teeth, more topographically than systemically, which is different than I was taught. And I know you like that better.
I love that. I love the show that we did. For any listeners, our show, you can go to our website, simpletruthsforhealthyliving.com, and listen to the show Dr. Jeff Haddad did on fluoridation of water and how that's really bad for us. It's a different type of fluoride, and it's
unnecessary.
And it's unnecessary, and it's harmful to our overall health. It might be good for the teeth, but harmful. So there's better ways to do fluoride.
I mean, when you have fluoride treatments, whether it be topical at your dental office or some of the rinses over the counter, you are getting as much, if not more, benefit than you would systemically. And that's different than I was taught in dental school. So things have changed. And another thing that
I know I'm segueing here, but could you just really quick reiterate how you do this fluoride varnish, right?
That's correct, yeah.
So you're getting less on the gums and in the mouth and tongue.
Fluoride varnish.
Systemically in the body. How does that work?
Well, and again, I actually, I've talked to the 4-year-olds about this because, as you and I grew up, they had fluoride and they put a big, tube of jelly and they'd put in those trays and, they'd put the suction back there, but you were ingesting
tell you not
it.
To swallow it.
Right.
Don't swallow it.
Right, right.
That's,
and it tastes
that's impossible,
awful. It's just,
right?
I remember it felt like it was torture. Well, there are better things out there, and what we use is a fluoride varnish where our hygienists literally paint it on the teeth. It almost congeals to a point on the actual tooth. So like you said, it's not going down, the throat. It's not all over the gums. It's
I like
specifically
that a lot.
right on the teeth. And what I did to demonstrate how fluoride works is I took some chalk and I dipped it in some food coloring real quickly, and then I broke it in half, and you could see the outer layer starts to get infused with this food coloring. And that's what happens with our teeth. That fluoride infuses into the enamel, protecting the outer layer of tooth from, it's anti-cavity. That's what it does.
So it fills in the pores of your teeth, right?
And what it does is the fluoride acts as a barrier and combats that bad bacteria that can cause an actual cavity. And so having the fluoride treatment's very important. For those adults out there listening, having a fluoride rinse could be one of the best things you could do for yourself. There's all kinds of them out there. There's the original one was ACT,
right.
ACT, and it's a good one. To be honest, I think there may even be some better ones out there. Listerine now, which was always just an antiseptic mouthwash, now has fluoride in certain.
I've seen that, yeah.
Which is great. And the other one I really like, I believe it's Colgate. It's kind of a total mouthwash. It tastes good. What gives you, your good breath, as far as a mouth rinse, and has a fluoride too. So adding that to your, armamentarium
how do you know
would be huge.
If you're getting too much though?
You can't, because you're just swishing and spitting.
Yes.
It's not systemic again, so you can't. You're putting in your teeth, you swish it for the recommended 30 seconds, to a minute, whatever, and you spit it out. That's all safe, And just like with children, a lot of moms are afraid of giving their kids fluoride toothpaste. Well, first of all, you should just be giving them a little pea size. It shouldn't even be an issue. If they were to swallow it, it's going to do nothing. But you make sure you teach them. You don't swallow it. You make it spit out. But again, you're using such a small amount. There's no concern for harm at all. Again, because it's topographical as opposed to systemic. Okay. And, it actually reminds me of really what I think has changed the most, I think, in dentistry from when I was a child to now. And I think you and I have talked about them briefly before, which are what are called sealants.
Sealants.
Okay.
Yeah.
Sealants, for those of you who are
we never had those.
No, we did not.
So when did sealants come out? Like in the early 80s?
I just missed it. I would say that I think my guess would be probably more like the mid 80s, maybe. Okay,
Mid-80s,
when they start becoming more of mainstream, mid to late 80s. Don't quote me on that, but that would be my guess, because I never had them. Okay, and I missed my window, and that's really why I probably had so many cavities. Because I'm going to tell you, sealants are the key to helping your child get through those younger years where they're not brushing as well as they should be. They just can't. They're children.
Right. It's not a focus that they have.
Yeah, it's very difficult. And even parents who do a great job of getting in there and doing the best that they can, kids have very deep grooves in the chewing surface of their teeth. And that's what these sealants.
Is that right? So kids have deeper grooves.
Well, we all. It's
when you're younger, you have.
Not necessarily. No, I what I mean is everybody has deep grooves to a degree. Some have very deep grooves, some have a little bit more shallow. But the point is, as we grow up, if we're not brushing as well in those deep grooves, which most kids are not, that's where it goes against them. And so sealants I recommend pretty much to every child that I see, unless for whatever reason they have very shallow grooves and it just doesn't benefit them, which doesn't happen very often. But what a sealant does is it literally fills in the groove with a resin plastic. It's similar to, the composite fillings that we use, but it's a liquid form of it. So it's not as hard. It's not as thick, smaller particles, nanoparticles that flow right into these grooves. We hit it with our little curing light, and it is completely sealed. Doesn't allow food to get in those grooves and cause the problems that it can. And it allows the child to brush his teeth a lot easier because those grooves are not trapping things. So it's the key. And also the stuff that we use, which not all dentists use, but I do my research, you know that. Ours actually has a fluoride releasing agent in it too. So you put this resin in the groove, and it's almost like having a fluoride treatment on your tooth in that area. It's going to combat any of that bad bacteria that's going to give you, possible cavities, and really just get your children through that bad
So what you're
bad era.
saying, so not only does I was just under the understanding that the fluoride filled in the pores of the teeth, but you're saying that it actually combats that this bacteria can't grow.
That's correct.
When fluoride is present.
That's correct. It is in fact, what I was taught is
it's actually like bacteria static.
Correct.
Sort of.
That's exactly it. And what happens is when you do have fluoride that's built into the tooth, again, as we're growing up, and that happens anyway because there's natural fluoride in foods and all these things, it actually makes your tooth stronger. The fluoride ion will actually infuse in the tooth and make your tooth stronger than somebody that doesn't have it, or vice versa.
Which would slow down wear, then, right?
Well,
like if you,
I don't know if it really wouldn't have anything to do with wear as much as I mean stronger as in against a cavity agent. Yeah, I'm sorry. Yeah, it's not going to make your enamel stronger as in petrified wood type stuff.
Right, right. I was just thinking for the grinding, for the bruxism we call it.
Right,
grinding your teeth, clenching.
Mm-hmm. Yeah, it's more of a bacteriostatic agent, but it's huge. And
stronger resisting cavities.
That's correct.
Okay.
And so as far as the way things, if those parents out there, I guess, who are listening, don't question if the dentist is just trying to push these sealants on you. It's the best thing you could do for your child. There's no question about it. Do your research on it. There's nothing bad about them. It's all good stuff. Absolutely, no question about it.
I do have some questions about the sealants.
Okay,
too. But
sure.
You want to go to a caller?
Yeah, that'd be great.
Okay. Hi, Crystal. You are live and on the air.
Hi, Joe. How are you?
Wonderful.
Good. Thank you for taking my call.
You bet. It's an honor.
I would have a question. Oh, go ahead. I'm sorry.
Oh, this is a dental question for Dr. Haddad, huh?
Yes, it is. It's like 90% of the time when I brush my teeth, I get like a stomach ache. It's not like a normal stomach ache though. It's like not like a nauseous feeling or anything like that, but is there something in toothpaste that could be upsetting my stomach that you could point out, or would it have to be something that I would have to test?
Well, that's a good question, Crystal. Let me ask you this. Do you know what type of toothpaste you're using, and is it always the same toothpaste?
I usually stick to Colgate. I've been using Colgate for years now. I mean, I've probably tried a few other things, but I've mainly used Colgate, and I usually get the whitening one.
Well, that you know what, Crystal, I'll tell you, that was what I was going to ask. What I tell patients of mine who, and our bodies change. I became lactose intolerant when I turned 21, and I miss my milk. I'm going to tell you that right now. But bodies change, and so what I tell people when they go through phases like this is to go back to the basics. Go back to the normal crest. And I know it doesn't taste as good as everything else, but it doesn't have all the additives. It doesn't have all these extra things that could be upsetting your stomach. There's a normal crest, nothing, fancy, nothing sexy, but it does the job. And honestly, I have yet to have a patient that didn't go back to that things like this didn't resolve themselves.
Okay.
Does that help?
That did help.
Well, tell me this. You know, Crystal, have you ever tried brushing your teeth without any toothpaste to see if you got the upset stomach or this nausea type of?
Yeah, I have before, but I never thought that it would really. I didn't think it was cleaning deeply enough without the toothpaste.
Well, I guess the question is, do you get nauseated without using any toothpaste?
Oh, no, I don't. But it does keep me from sometimes brushing my teeth, and obviously I can't be doing that.
Right. No, I think, Crystal, your best bet, give the Crest a whirl, because, you do not want to be and believe me, obviously I don't want you to make yourself sick, but you want to get to the bottom of the problem, because I'll tell you, very quickly dental problems can arise, and you do not want to put yourself in a situation like that.
Right.
Hey, Jeff, have you ever heard of Tom's of Maine toothpaste?
Yes.
Yeah.
Yeah, absolutely.
Are you any comments on that?
No, again, any toothpaste is fine. I really have no problem with it. I definitely don't agree with the non-fluoridated toothpaste, though, because like we just talked about, having fluoride topically on your teeth is the key to healthy teeth. There's no that's not really an opinion. It's a fact. And so you don't want to just have paste that doesn't have the fluoride in it, but any toothpaste, whether it has the extra things, whether it be the whitening or the, tartar control or whatever, again, whatever it takes for you to brush your teeth are great. Those whitening toothpaste, just so you know, Crystal, have more abrasiveness in them too. That's how they whiten. That's not because of the whitening agents in it. It's actually more abrasive than a normal toothpaste. So again, I feel like we're getting to the bottom of things with you, and I think we just need to back it up to a more simplified approach. The normal, good old Crest is, like I said, my standard that I send people back to, and I think you should give that a try and see if that fixes things for you.
Yeah, I definitely will do that.
Can you get back with us maybe next Wednesday and let us know if the Crest helped?
That would be great.
I personally do like Tom's of Maine.
Yeah, good.
Because it has the myrrh. You can get it with the myrrh in it, which is bactericidal.
Perfect.
Kills bacteria, but then it doesn't have the fluoride like you talked about.
And that would be my only problem.
That's your opinion, but I kind of like going to the dentist and making sure you're going to the dentist like you do, the varnishing on your teeth. It's a little more. As
long as you're getting fluoride at some point, I'm fine. And I know you get it in your diet as well, more so than other people. So no, listen, there's a balancing act here for sure. But yeah, Crystal, I would love to hear how you do. Keep us posted.
I listen to you guys every week, so I'm on my way home from school every night, and I just so happen to catch the whole show perfectly. So it's awesome.
I'm glad. Well, Thank you for calling. I think that helped out a lot of people too. Keep us posted.
Thank you for answering.
All right.
Well, you're welcome.
I have one really quick question about. I know a lot of parents right now who have sick children with high fevers, and I was just wondering if there's I've just been really telling them. I'm learning from you and listening to your show. I've learned that tea with honey and cinnamon and lemon is pretty much kind of like a cure-all. Kind of
that really is, especially like dandelion and peppermint tea combination with the honey and lemon, right?
Right.
So
that's pretty much just cinnamon is another one that I was.
The cinnamon's fantastic. Now cinnamon and clove, and cinnamon is pretty pleasant tasting. So what you can do is the clove powder. And Jeff, I'm sure you guys use clove oil.
Yeah, we talked about that. Yeah,
right?
Yeah.
For your gums, because it's bactericidal, it's virucidal, it kills viruses. So if you can get your kids to down some clove powder, and you can get it, right out of your kitchen cupboard. That's what I like to try to do, Crystal, is give you things you can use right out of you already have. Honey, the clove powder, just a quarter teaspoon of the clove powder, and you can be more generous with the cinnamon, like a half a teaspoon of the cinnamon powder. Mix it up. You can add a little honey to it, lemon. Now you've really got a concoction that's going to kill the virus.
And I've let a lot of people know about the Showbiotic. I've been using that. I've been breaking them in half, giving half to my children, and I eat half usually every day to try and.
Good for you. I'll tell you, I second that. I've been eating the chocolate. I'm a believer now that Showbiotic is with the way that as far as the stomach goes and everything. Oh, I love it. It's great.
Yeah, I
really,
listened to your show yesterday, and the orthobiotic, it got me thinking, and I didn't know, I haven't looked up online yet what the two differences are between the showbiotic and the orthobiotic, but I would love to learn more about the two differences.
All right, you know what? We've only got about a minute left, and you know what? We'll talk about that tomorrow.
Yeah.
Okay. But
I'll be listening.
Yes. Hey, thanks for calling, Crystal, and we're expecting you to call back next Wednesday, please.
Keep us posted, Crystal. Thank you.
Thanks for the call. All right, Jeff, you got about a minute or so.
Perfect. All right, I want to give a little list since Valentine's Day is coming up. All right.
Okay.
I want you to. What do you think the worst candy is for your teeth?
Choo-choo beads.
Yeah, good.
Good and plenty.
Along those, taffies. Right, very good. Yes,
right.
that's about the worst.
Sticky.
Okay. Hard candies people think are relatively good for them, but actually most hard candies people keep in their mouths for a long time.
Right.
Lowers the acidity levels in your mouth, and boom, that's when cavities happen. So that's bad.
Okay. Anything that you suck on or keep it on one spot.
Absolutely.
Right. Okay.
Stay away from those Altoids with sugar. I'm telling you, I see a lot of problems with that. Honestly, one of the best things you could do for yourself is eat the regular chocolate. Peanut butter cups, you would think would be better because they have the protein, but that sticky peanut butter keeps it on your teeth longer.
Keeps it on your teeth longer.
This is what I found interesting. You know what one of the safest candies are for our teeth, and it goes against everything I believed in? Pixie sticks. You remember the Pixie sticks? That
those
you just pour in sugar, right?
Yeah.
I mean, can you think of a worse thing? But actually, most kids, they pour it right on their tongue. It bypasses the teeth. It's absolutely inhaled, essentially, and it doesn't affect the teeth, which was against what I believed in. So I guess moral of the story: stick with your chocolates and your Pixie sticks for Valentine's Day, or if you're really gonna behave, just stay away from it all. But brush
you need to come up with a healthy Pixie stick.
Ooh, I like that.
Like maybe rose hips and other things that
I like maybe some of that diamond crystal salt. Who knows?
We got to come up with something.
I like it. We're on it.
Well, that is it for the show tonight.
How did that go by so fast?
So it did go by fast. So Dr. Haddad does recommend sealants for children. That's a thumbs up.
Yeah, absolutely. And again, if anybody wants any information on that, our website is available, RochesterAdvancedDentistry.com. Call our office at 248-656-2020. And I still owe the Simple Truths for HealthyLiving.com a few of my recommendations, so I'm going to get on that for you too, Joe.
All right, thank you. Thank you very much, and God bless you all. Remember, all that you eat or drink or do all things to the glory of God, and we'll see you tomorrow night.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11. Edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.